Capgras syndrome or delusion is also known as imposter syndrome. It is a rare condition in which an individual believes that a person close to them has been replaced by a double or an imposter. The imposter looks like them and assumes their role and behaves like them. The replaced person could be a spouse, a family member, a close friend, or even a pet. Sometimes the patient may believe that there are more than one version of the same person. Joseph Capgras was a French psychiatrist. He co-authored a paper in 1923 in which the syndrome was first described. They termed the disorder l'illusion des sosies, which means illusion of lookalikes. The patient that was described was Madame M, who believed that her husband and other people had been replaced by imposters. Initially, the syndrome was considered to be a purely psychiatric disorder. However, now it is recognised as a neurological disorder in which the delusion primarily results from organic brain lesions or degeneration. Capgras syndrome is commonly associated with Alzheimer's disease and other dementias such as Lewy body disease, schizophrenia, brain injury, rarely epilepsy, and other organic conditions. What about treatment? Treating the cause of the condition is what matters most. So, for instance, in schizophrenia, it would be antipsychotic medication and psychotherapy. In dementia, anti-dementia drugs. And in organic brain lesion surgery, if that's possible. Bye for now.